This is our one-on-one conversation with psychologist Dr. Jeff Gold. Thank you for joining us today.
Thank you for inviting me.
So, can you tell us a little bit about what you do and a little bit about your practice?
Yeah, sure. So I'm a clinical psychologist. I offer therapy services and psychological assessments, mostly for adults. I work both in person here at our office in Midtown Manhattan and also remotely through teletherapy.
A lot of our patients are older. Can you just discuss how important mental health is to the healthy aging process?
Yeah, sure. So I think it's important to keep in mind that aging is really more than just changes in the body. It's changes in the mind and changes in lifestyle. Mental health is a huge part of that. I would say what I offer as a psychologist is usually having to do with dealing with your thoughts, your feelings, your behaviors, your feelings about yourself and the world around you. And mental health incorporates more than that. It also incorporates the way your body feels and functions. It interacts with your physical health and your environment socially, your family, your friends, where you find a sense of purpose. I would say mental health is really important for the aging population, also in that it affects some of the things that start to change as we get older. In particular, like our cognition. So it's natural that cognition changes as we get older, and that our ability to store and retrieve memories, our attention, our energy level, all of those things start to change. If you are dealing with a lot of stress, mental health problems, chronically poor mood, things like that, it makes that process much more difficult to manage. So making sure that you take care of your mood, your stress, your anxiety, that's going to help protect you against that kind of decline that you might see in cases like dementia and things like that.
We see that all the time when we first meet a patient who hasn't treated their hearing loss. They're frustrated, they're totally isolated socially in a lot of cases. They become
Mhm.
depressed. Untreated hearing loss is, paramount to healthy aging too, and exactly all the ways you just mentioned. A lot of our aging patients, they're very anxious and they're stressed because
Mhm.
either their family members have been complaining about their hearing or they are noticing an issue and not ready
Mhm.
to treat the problem until it's really bad. We commonly help them cope with that. So,
Mhm.
where do you come into play in helping those patients?
Hearing loss is exactly the type of thing that is more likely to happen as we age, and that, of course, is going to have a big impact on your feelings like anxiety and depression. So I imagine a lot of what you're seeing in your patients has to do with the ways that hearing loss starts to affect the ways they interact with people. It can absolutely lead to depression in the sense that it can lead to social isolation. If you are unable to connect with people, if you're unable to do the things you used to do to stay part of a community, then it's really easy to slide into depression. That's one way that my work as a therapist might make an impact, would be how do we actually help you stay connected to people, given that there are these changes going on in the way your physical body works and in terms of how you hear. Um, Same thing with anxiety. So it makes a lot of sense to me that a lot of these patients come in anxious when they're dealing with hearing loss, especially if it's untreated for a long time. If you just imagine what it's like to interact with somebody and not be sure if you're hearing them well, if your needs for communication have kind of like grown beyond what people can understand or are comfortable with. But there are absolutely things we can do, right? I think learning to understand the impact that these things have on you, the way that your changes in hearing are affecting the way you feel, understanding what you can do about that, what kind of um, skills and changes you could make in your life to actually make it possible to stay connected or manage stress. That's all part of, I think, the adjustment to something like changes in hearing.
When it gets to the point of depression or social isolation, then you know that this patient has waited a really long time to do something.
For
And
sure.
I think social engagement is more than just hearing. We can help anyone hear better, but then they really have to change their behavior and not avoid those social gatherings where there may be multiple people talking at them at once or background noise, like in restaurants. A lot of our patients avoid those situations before treatment. And then to get them to want to or motivated to take the
Mhm.
risk of putting themselves in that situation that used to cause pain, that's hard for them. Yeah, I feel like what you do is so, so important.
Yeah, I think that's one of the most challenging parts of depression is that once you've kind of entered into depression, you really lose that motivation and energy and sense of purpose that would have in the past driven you to do these kinds of things. So once that's happened, I think there is really a need to actually make those changes on a small, gradual, step-by-step level. And if part of the cause of it with that was something big changing in your life, like hearing loss, um, there's a lot more that's going on for you in that. There's grieving around the loss of functioning and the changes in your body, entering into
Yes.
a new phase of life. So none of this stuff happens in a vacuum. And yeah, once you realize that I am not doing well, right? Maybe I'm depressed, maybe I'm dealing with a lot of anxiety or something like that. That's when help from a therapist can actually really make a big difference because you've kind of crossed over into a place where you need help dealing with all of those contextual factors. And yes, you should be treating whatever's going on, treating the medical conditions, treating the hearing, doing what you can to keep your body healthy. But also, you might sometimes need help dealing with just how it feels going through these changes and um, how different it is actually to engage in behavior that used to be very normal for you, even maybe a few years ago or 10 or 20 years ago, and now kind of take something different. Look, as adults, we all do things that are tough. We all have to be strong and resilient, but the ways in which we show up to our challenges, that does change throughout the lifespan. And there's absolutely no shame in realizing that, the ways I got through life in an earlier stage are just not working for me anymore, and I have to rethink how I approach things. Maybe you were the type of person that had tons of energy, and that was never an issue for you. And then you get older, and your body changes, your mind changes, and it just doesn't work that way anymore. And you still want to stay active and connected, but you have to kind of approach that in a new way. That's where talking to somebody and getting some help can really make a big difference.
Oh, yeah. A lot of people are also, as they age, scared to raise their hand and ask for help. Some people, at least patients that I come across, a lot of them are do-it-yourself people.
Mhm.
But as we get older, it's hard to do it yourself,
Mhm.
and you don't have to. There's, physicians and doctors out there who can support you and make you the new best version of yourself. Speaking of which, I want to talk a little bit about our tinnitus patients.
Sure.
Tinnitus is one of the more common symptoms of hearing loss or auditory damage. And often when the tinnitus gets really bad, it's goes back to the patient has waited so long to treat their hearing loss that their tinnitus is now controlling them.
Mhm.
And we could treat the hearing loss and help the tinnitus. However, we notice that a lot of these patients already have really bad high levels of stress, very anxious. So, can you just walk us through some of the negative implications of stress and anxiety on the body?
Stress and anxiety can definitely affect the body. I'm cautious about giving a message here that'll make a stressed out person feel even more stressed. But what you should keep in mind is that stress is going to have an impact on you, and you should take it seriously. Um, like you were saying a moment ago, get the support where you need it, right? Like that doesn't make you less strong, right? But get the support where you need it so that you can actually manage your stress. There's multiple different fronts on which you could attack this. You don't need to be in therapy to start working on this, right? But staying active, staying connected, getting good sleep, um, making sure you don't avoid taking care of medical problems. That's very easy to do as we get older, especially that um, there's new medical problems. They can be stressful to deal with, but it's better to treat them and start working on it. But also then to cope with changes in your body and medical life. Maybe you're dealing with treatments that changes the way you function, things like that. Um, so working on all those fronts is important. Stress can have a big impact on the way our minds function, our ability to do things, our ability to focus, our ability to enjoy things. And the more that those impacts start to affect you, the more you can end up withdrawing. And the more you withdraw, the less you do all these other things I was mentioning, like staying active and eating well and taking care of yourself. Um, and so, yeah, I would say it's really important. Look, I think tinnitus is a really good example of actually something that's incredibly difficult to live with, right? As you were talking about, right? There's treatments for this on the hearing loss side and things that you can do, in your sort of work that make it a little bit easier for people. But also, in many ways, it is very much like dealing with a chronic pain problem.
Hmm.
And it can even be more complicated than that for a lot of people because sometimes it's hard to almost explain to people, or it can feel invalidating. People say, "Oh, you don't really have, an actual pain thing," right? So I think it's so important that people know that this is like a very genuinely, difficult thing to be living with, and that if you're struggling to manage your stress in all those other sorts of ways, taking care of yourself and staying connected, therapy might be a good option. Consulting with a doctor about medications might be a good option. There is help out there that's specialized for people with tinnitus to help you learn skills. It's not going to help the ringing go away, but it will help you learn to cope with the ringing. It'll help you learn to get some control back in your life and not let this experience totally take over.
Hmm.
And so if you're even starting to feel like that's happened, or you've been living for a long time feeling like hearing loss or tinnitus really has taken over your life, your behavior has changed, your perspective has changed, that's a sign to get some help. And there are things
Yeah.
we can do even in a short-term treatment with a handful of sessions, 4 to 8 sessions maybe, that might make a difference. In a severe case, you might want to do a little bit more than that. And of course, there's always additional support beyond these sorts of like short-term skills treatments. But yeah, I think they can make a really big difference. And people are often surprised that um, what to them maybe sounds like something they're skeptical about could actually really make a huge change in their quality of life.
Oh, absolutely. When we treat hearing loss and tinnitus, we get it to the point where it's fading in the background. However, there's some cases where the patient gets really anxious or stressed, and that brings the tinnitus back into the forefront. So it went from
Mhm.
not noticing it so much to all of a sudden it's loud, and there's this moment of panic, and that's where I feel like the adamant referral to someone like you
Mhm.
is paramount to helping them develop those coping strategies too. So yeah, thank you so much, Dr. Jeff Gold, and it was a pleasure having you. And if one of my patients or any of my patients want to get in contact with you, how could they?
Yes, thank you for having me. This is great to talk about this stuff and get the information out there. You can reach me directly through my contact info through email. You could also check out my practice's website. It's Therapists of New York. So it's therapistofny.com. Get more information. We have offices in Midtown, Brooklyn Heights, and Northern New Jersey. We also do teletherapy as well.
We have an office in Brooklyn Heights, so that's good to know. And telehealth appointments are great too for a lot of our patients who are immobile. So thank you for coming on and look forward to talking to you again.
All right. Thank you.